Yep.
Sorry about that, folks. You know, I'm the first to tell you that, well, first of all, my name is Andy Cartmill, and I'm with Washington County Addiction Services, and I have been with the county for a long time, and what I do is I spend my time out in the community, and I do two things. I give information on substance use disorders, gambling use disorders. I do suicide intervention trainings, mental health first aid, with the whole idea is I don't want the process of a disorder to begin. And so I give information, but what people do with it, up to them. And the second thing I do is if the process has begun, I turn them on to people like you. I turn them on to treatment providers. I turn them on to peer services, but I can't make anybody do anything. But I speak probably 200 times a year, and I spend a lot of time out in the community. I talk to thousands of people, and I let them know that we have people like you out there as wonderful resources. So, Jessica, do you want to introduce yourself?
Sure, yeah. So I'm Jessica Ferrante. I'm a gambling treatment therapist at LifeWorks Northwest. I primarily work out of Beaverton right now, and I have been a gambling treatment therapist for about 4 years now. So I'm kind of, one of the people that Andy is talking about, that when he goes out and does presentations and talks a lot about prevention, I'm one of the people that we refer to, which is wonderful because we can still do treatment. I see one comment in the box right now. Trent does not work at LifeWorks anymore. I'm so sorry about that. We all love Trent. But I actually took over Trent's position when I had come into this role. So that is me now at LifeWorks, along with one other colleague. And I also love being able to do presentations, and I talk at a lot of different places, including the National Conference of Problem Gambling, which will be happening later this year, because outreach and inreach is part of my main goal, just to raise awareness about problem gambling and get clients connected with treatment that they really need, because it really can help. So that is why I'm here.
Perfect. Thank you. So what's the big deal? Why are we going to talk about gambling? Well, in a very simple, foundational way, I'm going to tell you the reason we're talking about gambling is because no one else does, and we need to. And we're going to tell you why. We're going to kind of divide this into two perspectives. Me as a non-clinician and as an educator, I'm going to give you what I prefer to refer to as like the lay perspective. I'm going to give you a tiny little bit of a history lesson in regards to gambling. I'm going to talk about the perception versus the reality. And that is so important in doing what I do. And as you all know, I'm sure that a lot of people we work with, a lot of people we talk to, their perception isn't exactly what the reality is. Well, I'm going to talk about the relationship between gambling, our youth, and other disorders and suicide. And again, from a lay perspective, going to give you an idea why we talk about this and why it's so important that you put this on your radar if it's not there already. And then Jessica is going to get on there and give you that clinical perspective, talk about the importance of peers, and just give you the clinical aspect of this disorder. And I think you'll find out it is very similar in many, many ways to a substance use disorder or any disorder. And then she'll talk about gambling and recovery, resources, and then it's going to be done. It's good information. So thank you so much for being here. Thank you, MHAAO, for making this happen and making this possible and for including us. So I'm going to go ahead and get started. First of all, it's kind of important to know where you've been to know where you're going. By the way, since this is virtual, we're not going to have polling or anything like that, but we're going to ask some questions that it can be rhetorical. You can respond in chat with answers, and we'll monitor those. We will have times periodically throughout this presentation where we'll solicit questions and comments. And feel free to, in the chat box, at any point, write a question or a comment. And if you don't have one, no problem. It's okay. So let's start with a tiny little bit of history. It has been around. And it's so funny. We, in 1607, 104 Englishmen set sail for the New World. And it was in 1612 when we had our first documented lottery. 1612. And as a matter of fact, it's been written that in 1607, of those 104 people from England that sailed over, some of those individuals were actually wagered. And gambling really has been around. And our first law came about in 1630. And it said, all persons whatsoever that have cards, dice, or tables in their homes shall do away with them before the next court under pain of punishment. You can gamble, but you'll do it in our house. Sound familiar? It only took just a few years, from 1612 to 1630, to have the first law on the books, because they discovered it caused social issues that they weren't anticipating. Raised a ton of money, wonderful, but it caused problems. By 1744, state of Virginia said, forget it. It caused so many problems, we don't want it anymore. So gambling was banned. But then in about 30 years, we had the revolution. We had to pay for guns and bullets, uniforms. We fell back in love with it. That's a ticket from a 1776 lottery. By 1831, there were 430 lotteries operating in about 8 states. And we fell back in love with it. Prohibition came. Drinking became illegal, and it became a horrible, nasty vice. And so they banned it, and that worked beautifully, didn't it? Everybody stopped drinking. You know, the same thing happened with gambling. They stopped gambling. The reality of it is, it actually spawned new industry, just like with alcohol, speakeasies, pubs. NASCAR started with prohibition. Gambling was no different. It was a horrible, nasty vice. They banned it, but people kept doing it. 1930, state of Nevada said, we want to legalize gambling, because up to this point, it had been illegal in the US. So the federal government gave Nevada the okie dokie, the official okie dokie, that you can gamble in the state of Nevada. This guy took advantage of that. Bugsy Siegel. He opened the first hotel casino complex, 1946. It's the Flamingo Hotel, still there. Started Vegas. Quite a vision. In 1988, Indian Gaming Regulatory Act came about. And what a lot of people don't understand is that this made Las Vegas sweat. Because Vegas was saying, who's going to come here? Who's going to come here when people can drive 20 miles to their own casino? So Vegas changed their marketing. Vegas was no longer Sin City. It became a family destination resort. And again, I don't blame them. They're very smart and good at what they do. Now, as it turned out, people kept going to Vegas. But opportunities to gamble were expanding like no other. Gambling has been around. So here's your first question. And again, feel free to reply this in the chat. This could be rhetorical, but a little trivia for you. Why do dice have dots instead of numbers? Was it because the numbers were considered evil in the early 1700s, so they weren't written, only spoken? How about when dice were first used, there wasn't language. They didn't have numbers. What about the dots? Well, they just look cooler. Numbers were boring. Or by using dots, they only had to go to 6. And the space on each side, it was filled with dots pretty easily. And those of you, the last choice there, those of you that are parents, especially parents of teenagers, I talk to thousands of students, and have you ever noticed that when you ask them a question, oftentimes the answer you get is, wait, what? So that's why I put that there. And I always ask, why do you say wait? What? But it's true. So if we take a look here, dots are universal. Not everyone could read numbers. Illiteracy, all right. You know what the answer is? This was established before there was an established language. A system hadn't even been developed yet. Gambling has been around. It's really, as long as there have been people have looked to enhance themselves chemically. For me to come in and say, don't do drugs, that message doesn't work. Because people go home and watch commercials, 50, 75 commercials telling them, do drugs. We use drugs in this country from birth to death. That's a reality. We don't talk about gambling that much. Gambling is in the Bible. They cast lots for the robes of Jesus. It's been around. It's really nothing new. Take a look at these pictures. These pictures, they have something in common. And folks, what it is none of them are photos. Every one is a drawing or a painting. That's a pencil drawing. That's a ballpoint pen drawing. Isn't that cool? That's an oil painting. Here's why I show people this. And what I'm going to do for you today is I'm going to give you an idea what I tell other people about gambling when I bring this up, because every time I speak on substance use disorders, mental health issues, suicide, when I always include gambling. It's perception. What you think is real isn't always real. And that's a big deal in doing what I do. Personally, I don't give a ton of stats. Now, everything I tell you is data-driven. Everything I tell you is scientifically defensible. However, I've learned that I don't give a ton of stats because no one cares about them. But I give you a little, and it goes to perception. So, for example, when I ask 8th graders, what percentage of your classmates drank alcohol at least once last month? They tell me 80% do. You think that's accurate? Not even close. However, if I think 80% of my classmates are doing something, would it make sense that I am more likely to give it a shot when I get the opportunity? Perception's a big deal. It's not always what's real, though. Now, my jurisdiction is Washington County. If I were to ask you, what are youth in Washington County, what are they doing? Are they drinking more? Are they vaping more? Are they ingesting THC? Are they gambling? Are they smoking more? What are our youth doing? I'll give you a sec to either think about it or to chat. All of them. I can tell you what our youth tell me. And Carolyn, when you said vaping / THC, that's exactly what I hear. I hear THC and vaping. All of them. Okay. The answer, ladies and gentlemen, is our youth are gambling more than they're doing any of this other stuff. When I go to schools and talk to school boards, teachers and stuff like that, look, when you have curriculum talking about substance use, mental health, we talk about sex and drugs, you got to include gambling. Not that it's evil, not that it's terrible. Most people don't have a problem. However, a growing number do. Not everyone we know that drinks alcohol has a use disorder, but we know that some do. We know there's a downside. If I do this to cope, that's a problem. And I'm telling you that the rate of pathology amongst our youth is about twice that of adults in Oregon. And our kids are gambling more than they're doing this other stuff. It doesn't mean they have a problem, but they're doing this more. So here's your stats. 8th graders think 80% of their classmates drank. You guys, if you went to church and you had communion, you could answer yes to this question. 11%. We have issues. We absolutely do. And we have a number of youth that use, but perception is a big deal. This black bar here is depression. And the question here is, have you ever been so sad for 2 straight weeks, at least once in the last year, where it's affected how you live your everyday life? You guys, 20% of our 6th graders said yes to that, and over 1/3 of our juniors. Yet one of the messages I give our youth, most of you don't use. How often do you hear about the 76% that didn't drink? How often do you hear about the 83% that didn't ingest THC? Not in any form, not once in the last month. Not everyone's doing it. The perception is our punk youth are using. They're all using. The reality is, no, they're not. Our youth make good decisions more than they don't. They do the right thing much more than they don't. It's a message they need to hear. Parents, tell your kids when they tell you everybody's doing it. No, they're not. Now, everyone you know might be doing it, but not everybody's doing it. That's one message. Here's another one. That's how many of our 6th graders gambled, and 8th graders and juniors. Again, I don't have a problem with gambling. I have a problem with problem gambling. If I do this to cope, that can be an issue. And more, anecdotally, the stories I hear from students, unbelievable. So I just want to put this from a statistical standpoint on people's radar. Now I'm going to anticipate a question. What are our youth doing? How are they gambling? They're not going to casinos. They're not going to, they can't play video poker here. You got to go to a bar. You got to be 21 to do that. The top 3 things that our youth who report gambling, what they do, number 1, games of skill, which could be just about anything from dice to flipping coins to playing pitch. Remember that? Playing cards and betting on sports. These are the top 3 things. There's also online gaming, which is a whole nother training. But just like with any use disorder, if it gets in the way, it's a problem. It's not so much what they're doing, it's why they're doing it. If I'm doing this to take the edge off, if I'm doing it to cope, again, that's where it can become a problem. So, questions, comments. We'll stop a couple of minutes if you want to write something in the chat, anything like that. If you don't, no problem. When I let people know that gambling is what most our youth are doing more than anything else, that's always a huge surprise, not only to our youth, but to parents. Okay.
And if I might, at this moment, one of the reasons why this ends up being so important is it really calls all of us to question, what do we mean when we say gambling? Because if we're assuming that when we're saying gambling, we mean casinos, we mean video lottery, then we're going to miss a whole bunch of people, including, all of the youth that Andy is talking about right now. But if we're able to expand our definition of what is gambling, gambling is loot crates, gambling is sports betting, gambling is sitting with family and playing a card game, gambling is betting on the local high school football game, whatever that ends up looking like, then we are much more equipped to be able to ask these questions and have these conversations in a way that other people aren't doing.
Thank you. And Kelly asks, are they gambling for funds or goods? Gambling by definition is risking anything of value on the outcome of an unpredictable event. And I know that Jessica's going to go over this as well, but both is the answer to that. But again, it's, if I'm doing this to cope, because when I gamble, that's when it takes the edge off. I've had a rough day. This relaxes me. So I use this to cope. And again, Jessica will go through this, but part of, the use disorder, it has to do with escapism. It may have to do with action, but it gives the person something. And actually the money that relationship with money is different. To a person with a gambling use disorder, the money is more of a tool or a trigger than what they're after. But again, Jessica can go over this clinical part, but it's really fascinating. So my thing is this. On the substance use side of things, for me to go in and say, don't do drugs, it doesn't work, because we are a drug-using people. We are a chemical-using people. And don't get me wrong. Drugs have killed things that kill us. Matter of fact, topically speaking, we're anxiously awaiting another drug that's going to help us out of this thing. So why do people use? I can tell people that doing this in a pathological way, it's going to be bad and you're going to have trouble down the road. Do you all remember being adolescents? Do you remember thinking 6 years ahead when you were 13? Or was your life and your world right here and right now? We've had fifth graders come to school drunk and ask, why'd you do that? They give the same reason that any of us would give: stress. I would no more tell that fifth grader he doesn't have stress in his life than I'd tell you, you don't have stress in yours. That's ridiculous. What matters is what that fifth grader thinks. Every single one of you in this call, in this session, the path you've taken to get here today, the only thing I can tell you about it is it's different than mine. That's it. I have no idea the experiences you've had, what your home life is like, what you've been through. I don't know. I don't pretend to know. The only thing I can tell you is it's different than me. The other thing I can tell you with relative certainty is the paths that some of you have taken, I will never relate to, ever, ever. It's unique, but it gives you your perspective. This is why you see things the way you see things. Why you do things the way you do things. It all has to do with your path. I was in a fourth grade classroom where this little guy threw his stuff down and he says, I know about addiction, and he stormed out of the room. And I asked the teacher, what was that about? And he said, well, his mom OD'd at home last year and she died, and nobody got her for 3 days. He was with his mother's body for 3 days. That's his introduction to substance use, addiction, and he has a perspective I'll never have, and he has it in third grade. The paths that some of you have taken, I can't relate, and I don't pretend to. So why do people use? Why for every three people that smoke that first cigarette, 2 keep smoking? I've smoked 1 cigarette in my life, and it was for a girl. And apparently puking, not that attractive. Didn't work out. So as I'm horfing up a lung, I'm thinking, who does this? But like I said, the reality is for every 3 that smoke that first, 2 keep smoking. I'm from Bend, so obviously I was issued a can of chew at birth. And I remember when I first started, it made me sick, but I powered through. Where's the logic in that? There is no logic. When we talk about addiction and use disorders, we try to apply logic oftentimes to very illogical situations. We talk about trauma, paths, the paths that we've all taken. If trauma is represented by that bear, when you see that bear and you're out hiking, your gorgeous, beautiful brain goes through a process called the hypothalamic pituitary adrenal axis. God, it's a very cool machine, your brain is. What it does is it tries to keep you alive. Your heart rate increases, your blood pressure increases, your airway opens, your muscles tighten, you get ready to fight, flight, or freeze. Hypothalamic pituitary adrenal axis. But the thing is, depending on our paths, we react differently. Some fight, some flee, some freeze. This is a life-saving process. This is a fundamental process that helps us keep alive. It helps us stay alive. But the thing is, that bear, you guys, it's different for all of us. The loss of a job to one person doesn't mean the same to another person. What's trauma to you isn't necessarily trauma to me. That person that's physically, sexually, emotionally abused, they see the bear every day. Imagine. If you've been in a bad car wreck, you know that it's not like 3 minutes later, you're like, whew, that was weird. And then you head off and say, wow, that was rough. It's not like that. Hours later, you're still shaking and it's hard to catch your breath. That's the hypothalamic pituitary adrenal axis. It's exhausting. Imagine seeing that bear every day. We talk about discrimination. You see the bear every stinking, stupid day just for being who you are. Imagine. I don't have that perspective. Others do. We talk about bullying. We talk about all these things, all these traumatic events. But the thing is, trauma to you is different than what trauma is to me. Your clients, your family members, your friends, your coworkers, their paths are different than yours. What matters is how they perceive it. That's why listening is one of the most profound things we can do. And as peer support specialists, God, this is what you do. You listen, you advocate, right? What a service. What an amazing service. As a fixer, listening is one of the hardest things to do because we want to fix. Everybody's path is different. Trauma to you is different than trauma is to someone else. What matters is what it means to them. But it's very personal. Then we talk about the beautiful, gorgeous brain. I love the brain. What an amazing machine that is. Did you know that sucker takes about 25 years to mature, and it matures back to front? Back to front. When you give your 2-year-old or 3-year-old 2 pounds of M&Ms, you put it in a bowl, you slide it over to them, and you say, here, go to town. That 3-year-old will take those M&Ms and eat them until they hurl. Why? Because this beautiful part of the brain in your limbic system, the only thing it's doing is saying chocolate, good. That's it. Chocolate, good. So I will eat and eat and eat. If you remember being an adolescent, do you remember making decisions, at least in part, based on emotion, on impulsivity? How many times have you done something as a little dude you thought was a great idea? Now you realize how stupid it was. Did you know that's tied directly into our pleasure reward center? It's an amazing machine. The brain has an unbelievable capacity to create habit. Every substance of abuse has one thing in common. It's dopaminergic. It raises dopamine levels. Gambling does the same thing. The same dopaminergic pathways are utilized. It's a really amazing process. But I don't talk to youth, or I don't usually talk about this stuff. I point this out, but instead I will ask someone, do you remember crying without knowing why? And people can relate to that. Do you remember being so pissed at your parents, for example, when they got the nerve to say something to you like, good morning, when you've gotten up at the crack of noon? Right? What are you mad about? I don't know. Just leave me alone, right? It's not because our youth are stupid and evil. They're growing up. That amygdala, that nucleus accumbens, that beautiful, gorgeous brain is dealing with emotion, impulsivity. Our kids are smart, and I got the data to prove it. But their ability to suppress emotion and impulsivity is not as good right now as it's going to be. When we ingest a chemical, we affect our brain opposite of maturation, front to back. The first part of the brain affected is the last part to develop. Yeah, I can drive. Give me a break. God, I know where the cops sit. I know what I'm doing. I've done it 1,000 times. And I'm not kidding. I'm not lying to you. Dude, go get help. I don't need help. What do you mean you don't need help? You just got busted for the 5th time. Your family's got nothing to do with you. Do something. I don't got a problem. You got a problem. Why don't you just shut your mouth and get off my back, right? Again, there's a lot of misconception about use disorders and addiction. For some reason, people seem to think that they sat there as little dudes and said, you know, one day I am going to be a super good addict. I'm going to be the best addict I can be. Nobody aspires to this. Addiction sucks. It's painful. It hurts. But the thing is, the perception is if I stop, I don't function. People think I do this to get high. No, I don't. I do it to get through my day. I do it to feel normal. A person with a gambling use disorder goes through the same process. The dopaminergic pathways are utilized. I get a rush. I get a physical high, not so much when I'm gambling, but when I anticipate gambling. Oh, it's an amazing process. This is why early onset is a risk factor. And everybody agrees with this. When we start using chemicals, the earlier we start, the more likely there is going to be a problem. Doesn't mean there will be, but the more likely there is. It's the same if I start doing an activity such as gambling at an early age. If I start doing this to cope, that's a problem. When we look at substance use disorders and gambling use disorders, there's a lot of similarities. And again, Jessica she can elaborate on any of these things, but this is what I tell people. There is that immediate gratification. Preoccupation to me is an underrated characteristic. When a clinician says to their client, look, and let's say alcohol is their drug of choice. When you drive home, don't drive by your bar. Don't drive by the bar. Because what happens when you drive by the bar? You get triggered, right? It's more than that. When I drive by the bar, I get a physical euphoria. I get a rush of dopamine. I get a physical response from driving by the bar. So look, if you don't want to drink anymore, don't. The reason you don't stop drinking is because you just don't want to bad enough. You guys, it's not like that. It's like me asking you to stop drinking water. If I stop, I'll die. Preoccupation, perception. Nobody plans on this. So I ask you, where do you go in Oregon and not be stimulated to gamble? Where? You can't go to a store, watch TV, listen to the radio, read a magazine, newspaper. When you're walking in Oregon's beautiful forests, what do you see pounded on a tree? Paid for by Oregon Lottery. Again, I don't got a problem with that, but I'm saying the constant stimulation of when you drive to work, what do you see on a billboard? You see how many millionaires Powerball made. When you get to work, you got office pools, March Madness, Super Bowl, baby pools. Where do you go to not be stimulated to gamble? Think about that. You can't take a different route home. For that individual that's suffering with a gambling use disorder, it's brutal. There is that inability, that perceived inability to stop. I can't. If I don't stop, I don't function. It's scary. I got so much respect for people in recovery. It is not easy to do, but it is doable. There is tolerance, there is withdrawal, those cravings and urges. It's all there. The denial is not always a conscious act. I tell you I don't got a problem. I'm not lying to you. I don't have a problem. You got a problem. It's often accompanied with depression and anxiety. Gee, is there any of that now with COVID-19? COVID-19, you guys, is not normal. Stress and anxiety, that's a normal part of life. COVID-19 is not normal. What we're going through isn't normal. When we say, yeah, I'm working from home, I think it's more accurate to say we're at home during a crisis trying to work. There's a difference. So look at today. COVID-19 and how some of these can be exacerbated. I might not be able to get to a liquor store. I might not be able to get to my dealer for whatever reason, but I can gamble. I got access. Blackouts, brownouts, which is a partial loss of memory. Gamblers call it going on tilt without ingesting anything. The brain is an amazing machine. Escapism. My crappy life goes away for a little while. Again, the fifth grader that comes to school drunk, they're not doing it to be punks. They're doing it to go to school because now I got friends. I'm funny. I can talk to girls, whatever. Whatever matters to that fifth grader, that's what matters. We talk about the differences, and one of the biggest, folks, is it's hidden. When someone has a use disorder, they're on an elevator ride that's going all the way to rock bottom, and we hear so much about rock bottom. She needs to hit bottom. When she hits bottom, that's when she'll be motivated to stop, and it's true. But we have the opportunity every floor you pass on the way down to rock bottom to get off that elevator. What gets you off that elevator, very personal. What gets you off that elevator is up to you. For a gambler, for someone that has a gambling use disorder, rarely is there an intervention. You don't slur your speech. You don't stumble around. You can't smell it on your breath. So oftentimes that elevator ride down to rock bottom, rarely is there an intervention. It can go all the way down and no one knows about it. And I'm sure a lot of you have stories, just like I do. I've talked to a number of people with this disorder, and they've told, including youth, that have told me these stories of what they go through. And oftentimes when it is become known, it's because I have hit bottom. Last time I was in Coffee Creek, 4 women came up to me independently of each other, and they were all in there for embezzlement. And they had all embezzled over $250,000. It was all for gambling. There is no logic. We try to apply logic to illogical situations. When we're talking about use disorders, the individual sees things differently than we do. You don't ingest anything. Financially, it's huge with substance use disorders. It's defining for the gambler. Jessica can talk more about that, but that relationship with money is different. And then here, it's not perceived as a disease. DSM-5 seems to think it is. It is. It's a disease of the brain, just like with any other addiction or use disorder. There are fewer resources, but we have resources, and they're good. I just can't make anybody access them. And then you'll often hear, you've probably heard of video poker, for example, which is the #1 game of choice for people in treatment. But you've probably heard video poker referred to as video crack. And one of the reasons is that progression between first-time use and addiction, you guys, it can be pretty fast. And there's also a huge incidence of co-occurrence. I do one thing, I also tend to do another thing. The near miss. We talk about that beautiful, gorgeous brain. They've done functional MRIs of individuals that use coke and that gamble. Did you know the same part of the brain illuminates bright red? The same part of the brain is activated. When I play a machine, when an individual plays a machine that has a lot of near misses, and that means, like, let's say a line game, it's 7-7, and then, oh, God, I'm close. Dang it. It's unpleasant. But the research says that the individual plays that machine more because I know it's going to hit. And if you know someone that gambles, you've seen the ritualism, magical thinking. I can control what's uncontrollable. I wear blue. I play this machine. I don't play this machine. This is my machine, right? And if anyone's ever worked in a place that has video poker, you could probably tell me Friday at 3 o'clock who is sitting in this machine. You know how the commercials show that it shows the person at the video poker machine and he's playing and having a good time and his friends behind him are saying, hey, you're having fun. And they're all laughing and talking. When was the last time you went into a place that had 6 machines and you see that scenario? What happens if you walk into a place, Dottie's, Richards, Elmer's, whatever, and you just walk up and stand behind somebody playing, right? Do you see people chatting each other up very much? What's portrayed isn't necessarily what's always real. There's chasing. It's throwing good money after bad money. A lady in Washington County exemplified it beautifully. She had 20 bucks and she needed to parlay that into what she needed to pay her bills. And she's a good video poker player. She lost it in about 15 minutes. So she wrote a $100 check to get it back because I know what I'm doing and I will get it back. Lost it. Dang it. Wrote another check. Lost it. And then it becomes, I just got to get my money back. Just let me get even. She wrote 6 $100 checks in response to an initial loss of 20 bucks. Where's the logic in that? There is no logic. But in her mind, it was very logical. Chasing. Magical thinking. That unshakable belief in the power of one's own luck. I wear blue. It's how I hold the cards. I hate it when people sit to my left. Really, it's no different than if an individual, let's say heroin's their drug of choice, and they lay the paraphernalia out the same way each and every day. The ritualism is profound with a gambler. So last thing I really want to show you is this. I got to go to Ohio and at the national conference and give this data because no one else at the time had it. In 2018, we went to our analytics team at Washington County and I asked them a question. I want to know if there's a relationship between our youth, gambling, suicide, and substance use. And I can tell you that our youth that reported gambling in the last 30 days also drank more, used illicit drugs more, got into fights more. They did other high-risk things. Now, this is important. I'm not saying there's a cause and effect. If you gamble, you do these things. Not at all. What it says is that a person that does one high-risk thing, they tend to do other high-risk things. So that's why when I go to schools and I say, you talk about sex and drugs and mental health issues, you've got to include gambling. We talk about suicidal ideation amongst our youth. It probably doesn't surprise you that about 16% of our youth reported having serious thoughts of suicide at least once in the last year. This is in 18. Of our youth that reported gambling in the last 30 days, 19% reporting having serious thoughts of suicide. Of our youth that answered yes to one or two of 2 questions, have you ever lied to anyone about your gambling? Have you ever spent more than you intended? This is called the Lie Bet Survey, and it's out of Harvard. It's a screening tool that's used worldwide. A positive response to one or both of those questions indicates an individual is at higher risk. It doesn't mean they got a problem. It means they're at higher risk. But look at the pattern, and this is what I want to show you. Those that answered yes to one or 2 of those questions, you guys, that's almost a third of our youth that answered yes to those questions had thoughts of suicide. 7% report attempting within the last year. You guys, it's almost 1 in 5 of our high-risk youth. This is why I bring it up. This is why I think it's so important, not just for clinicians, for all our providers, for peers, to put it on their radar, but also for parents, for our youth. Just like when we talk about suicide intervention, well, one of the things we want to do is lower stigma, raise awareness, and make it easier for people to talk about suicide. It's the same thing here. We need to lower stigma and raise awareness about this and make it easier for people to talk about gambling. Not that it's horrible, not that it's evil, not that it's terrible. Most people don't have an issue, but some do. And I am telling you with confidence that your clientele, there's a percentage that have this issue. And if it's not dealt with, they're being done a disservice. I want help, but it's really hard to ask for it. Because if I ask for it, I might get it. I got to stop doing what I got to do to get through my day. It's a scary thought. But people can and do recover. We all know this. It's just not easy to do. Please put this on your radar. Yeah.
Sorry.
No.
Yeah, so we don't actually have to take the break. I know we're running up against time, but you know, if people have to take a bio break at any point, feel free to just go ahead and do that. But I think for the sake of time, we're gonna go ahead and just pass it off to Jessica, if that works for both of you.
Sure. Jessica, should I just stop sharing and then you bring up your slide deck?
If you wouldn't mind, because you're already on yours and I don't have mine pulled up off to the side, we could just go from there.
You just tell me.
Okay, so first thing that I want to be able to talk about is how we're developing what I tend to call our gambling antenna, or I have in here our gambling senses. Because again, what we're trying to talk about here is how we are changing the conversation around gambling. Because as peers, you guys are often on the front line of defense when you have different clients, when you're in different meetings, when you're having different conversations, that something might bring up that, I think that person might be talking about gambling. I think that person might be gambling. Whatever that might be, we're trying to develop that sense for ourselves so we're more likely to catch it. As of right now, we know that because of that stigma, and because everything that Andy has already been talking about, we don't talk about this enough. This is something that has such a high stigma. We don't have parents and teachers and, other representatives coming and talking to all of us about this. It's our job to be, okay, how do we make that net a little bit bigger to try to catch more people instead of using the same net, assuming that people are going to be coming to us first? Okay, next slide. So, come on, gambling disorder isn't a real addiction like substance use disorder, is it? Of course, the answer to that is yes, a resounding yes. Yes, it is. Because what we know is that brain imaging studies show that gambling disorder pathways are the same pathways involved in substance use addiction. So what we have is the same rewards pathway that is getting activated over and over and over and over again. Now, again, what's important here, and why I specifically like to call this out in slides, is any one of us can be sitting here and having a conversation and agreeing gambling disorder is a real addiction. It is something that impacts many different people, and we can recognize that. But our clients might not recognize that. The family members of our clients might not recognize that. The clinic that you work at might not recognize that. The person in the office next to you might not recognize that. So being able to come forward and say, okay, we know that this is going on. How do we get everyone else on board? And I believe it was somebody had asked the question earlier about how to decrease some of this predatory behavior. Predatory as in people offering gambling type activities, not necessarily being aware of what that might mean. And the answer to that question is we start that conversation. So, for example, by doing trainings like this, the hope is that every single one of you will leave this training equipped then to go back to your agency, back to a home group, back to a neighbor, a family member, a friend, and be able to say, hey, I know that this is a concern. I have more information to talk about this. We can change the way we start to talk about this in our agencies. And when we do that, we increase awareness. And when awareness is increased, then we have more treatment availability, really get people the help that they need. So again, gambling has a very similar natural history as substance use disorders. Gambling has similar symptoms as substance use disorders. And when you are having your, gambling antenna developed, it's going to be really important to start to parse apart where are these similar symptoms having an overlap and where is substance use disorder trying to hide the gambling. Because gambling is very sneaky, it's very insidious, and it tries to hide in a lot of different places. The way that I describe it for myself sometimes is if I am in the treatment room with somebody, I am always trying to pay attention to where the gambling is hiding. Is it trying to hide right behind me? Is it somewhere in the corner? I want to be able to shine a light on that because we don't want the gambling to sneak around and say, no, the reason that you're irritable right now is because you didn't get a cigarette today, not because you haven't gambled in the last 24 hours. We don't want gambling to come in and say, no, this isn't a concern. Don't worry, if you go to the bar every day in a week, you're definitely not going to relapse on alcohol. If you're going to the bar every day to gamble, there's a very high likelihood that that could impact your recovery. Those are the things that we're looking for, and those are the things that we're pointing out. We're also recognizing that there's a very high comorbidity with gambling disorder and substance use disorders and mental health disorders. So if you're somebody right now who is in a setting where you're primarily talking about mental health or primarily talking about substance use disorders, you are going to have clients that would benefit from gambling treatment or gambling services coming into those locations and not even necessarily realizing it. It's very common for somebody who is dealing with concerns with gambling to go in and seek different treatment. Maybe they're going in to see a mental health counselor because, I'm just feeling really depressed. My finances are all out of whack. I'm having trouble in my family right now. You might have somebody coming into substance use treatment and they're not really talking about their gambling because they don't want to see another counselor. They don't want to go to a 5th group per week. And again, it's part of our job to come in and then say, all right, we know that a large part of our clients that are coming in are also going to have concerns with gambling. Now it's our job to find it. Okay, next slide. Perfect, thank you. So another one of these small polling questions. It's estimated that how many substance use disorder clients have a gambling use disorder? Is it 1 of 3, a 1 of 7, 1 of 12, 1 of 25, or 1 of 50? Okay, we got a 1 of 25. 1 of 12, 1 of 12, 1 of 7, 1 of 7, 1 of 7. All right, lots of 1s of 7. And I apologize if my dog just poked her head in the screen. She eats at that time, the 3 plus 4 time. So she was like, wow. Okay, so go ahead and go to the answer. It is 1 of 7. So again, the reason that this is so important is when we have folks coming into treatment, now these are people coming into treatment for substance use disorder, it is reasonable to assume that 1 out of 7 people are having concerns with something gambling related going on in their life. Now, I would also like to call out at this time that that could include a family member, because in the state of Oregon, treatment is free for individuals that are impacted by gambling in any way. That means if they are gambling or if someone that they know, a loved one, a neighbor, a coworker, whoever might be impacted is gambling. So that means that we can refer family members to treatment. We can refer whole families to treatment. We can refer children, teens, adolescents, whoever that might be, anybody impacted by gambling. But if you are working in a clinic or you are primarily going to different locations, as I said before, meetings, where you're around people that may have a substance use disorder diagnosis, it's reasonable to assume that 1 out of 7 people would benefit from treatment. Now we call out here at the bottom that there's a difference between gambling disorder and problem gambling. Because again, in Oregon, And you might not know this, you do not have to meet full criteria in the DSM to receive treatment for gambling. You can have even just one of those criteria met. You can come up to somebody and say, you know what, I'm just having questions about what might be going on with me. And you still qualify for free treatment. That's amazing. And that is a system that we don't have in place for a lot of other treatment centers, especially in this state. So when we're having those conversations, we're looking, again, for that 1 out of 7 people. If you're thinking of your caseload right now, or the people that you come in contact with in a day, and you're kind of going down your list, again, 1 of 7 people. And we want to be able to develop our gambling antenna enough that we can find them and get them access to resources that they could really benefit from. Okay, next slide. So, why treatment staff should care about problem gambling. And I apologize if a little bit of this is repetitive, but individuals who have substance use and mental health disorders are the most vulnerable population to develop a future gambling disorder. And again, that goes back to a lot of what Andy was talking about earlier with that big and beautiful brain of ours, that when we're activating that reward pathway over and over and over again, it doesn't matter if it's substances, if it's gambling, if it's shopping, if it's video games, doesn't matter. We're still already have that reward pathway activated. And not to mention, we're talking about gambling a lot of the times as a form of escape. What are we escaping from? Is that symptoms of depression, anxiety, gambling and trauma go hand in hand, those adverse childhood effects. We're talking about alcohol that is available in most gambling locations. We're talking about cigarette use that can still happen in a lot of casinos. We are talking about I might use a stimulant before I go and I gamble because that stimulant is going to help me stay there and gamble longer. We're talking about somebody who, again, might use a stimulant as they're coming off of the crash of gambling because they can't handle being down in that very low place, so we want to help ourselves get back up. We're talking about somebody who might use a depressant because they're so up from that gambling that they need something to help them get back down. Gambling, substance use, and mental health go hand in hand, and it is often very, very difficult to separate one from the other. A personal disclosure about myself, the reason why I have 3 different certifications for mental health, for substance use, and for gambling is for this exact reason. I have the ability in my programs to provide treatment under this umbrella of gambling treatment for free and still be able to address substance use concerns and mental health. Does that mean that if somebody needs to go to inpatient treatment, needs more regular care, that I don't refer them? No, absolutely not. I don't want to say or imply in any way that I am the end-all be-all for this. But what this does mean is if you are working with someone for substance use disorder and you refer to a clinician, we're going to be able to keep in mind, we're not just talking about gambling here. We're talking about your substance use, we're talking about your mental health, we're talking about gambling, and we're not attempting to tease apart anything because gambling has its tendrils in all of this. We also know that research suggests that the more somebody is gambling, the less likely they are to succeed in mental health and substance use disorder treatment. So again, we're talking about relapse and relapse prevention. And if you have somebody who is just articulating to you over and over and over again that I don't know what it is, I just can't stay clean, I can't stay sober, I don't know what's happening, and all of a sudden you find out, again, that person is going to the bar every day to gamble, and they are constantly getting put in a place where they are being triggered for alcohol use. That's going to be a pretty good indicator of what might be going on. If you have somebody in mental health treatment, or you're seeing somebody as a mental health peer, and they are telling you again, over and over again, I just can't get along with my family. There are so many problems. I'm so depressed. I can't get out of this. I don't know what's happening. And we don't know that they're gambling, and gambling is causing just this roller coaster of huge crashes, then we are not going to be able to adequately help that person in their mental health symptoms because we don't have the whole picture. And I say all of this knowing that you might be thinking, okay, wow, that's a lot of pressure. Somebody might not be coming forward and telling me exactly what's going on, and I still have to figure out if there's a gambling problem. And, you know, I just want to be able to acknowledge that, yeah, it can be a lot of pressure. And we try to leave ourselves open all of the time for, you know, being able to answer questions, being able to help for support. We have helplines, we have people in agencies who are always willing to field some of those questions, because when you're starting to do this work for the first time and really starting to now pay extra attention to when people are talking about gambling, it's going to be different and it's going to take some practice. But when you start looking for it and you know what to look for, you're going to see it everywhere. Okay, next slide, please. Awesome. So, as we talked about a little bit, 5 to 20% of substance use disorder clients already enrolled in treatment have gambling disorder, or an average of 15%. So again, this is something that's hidden. We don't necessarily know this going into treatment, but we know that it exists. And the more severe the past year that somebody was using a substance, the higher the prevalence of gambling problems. So again, if you are thinking of clients, thinking of friends, family members, neighbors, anybody who in the past year or so may have had more severe concerns with their substance use, there's a higher likelihood that they might be dealing with gambling problems. Is this an exact thing? No, gosh, no, absolutely not. I'm not in any way trying to say that every person having concerns is also going to have concerns with gambling. But that just gives ourselves, again, that little antenna, something for you to say, oh, I might need to ask a little bit more here. I might need to dig a little bit more here. And individuals in medication-assisted treatment who have gambling disorder are twice as likely to drop out early and more likely to have positive UAs for cocaine. So again, very important to know, if we're dealing with any clients, any people in our lives who might be in medication-assisted treatment, we're going to want to ask about gambling. Because even if gambling isn't going on for them, we want them to be successful in treatment and we don't want them to drop out early. So again, then falls on us to be able to ask, really assess, re-ask those questions if we need to, so we can get the best picture to help that person through treatment. Okay, next slide, please. So, the reason that we put this slide in here is because it's a bit of a shocking statistic. 49% of those with lifetime pathological gambling, and that's an old term for what we call gambling disorder now in the DSM-5, reported receiving treatment for mental health or substance use problems, and none of those 49% of people reported treatment for gambling problems. And if we parsed out from this study a little bit more, none of these people were even offered treatment. Blows my mind. 49% of people already involved in treatment, and none of them reported receiving treatment or even being offered, recognizing that they did already have concerns with gambling. Now, again, these are individuals who already know that was a problem. This doesn't even include the number of individuals who might not have known, realized this was a problem, were questioning if it was a problem, just people who knew, not even offered. And, you know, again, a bit of disclosure about that, even in a company like my own, being at LifeWorks, I could say that the site that I'm primarily at in Beaverton knows quite a bit because they see me every day and I talk about it all the time. Even some of our satellite, you know, a couple of cities away from us, we still have staff that don't know a lot about gambling treatment, or sometimes that LifeWorks even offers it. When we're not thinking about gambling, when we're not talking about it and accepting it as agencies, it goes completely out of our mind and we miss so many people. And we don't want to do that. Okay, next slide. So, for DSM-5 and ASM criteria show that gambling disorder is seen as an addiction. Yes, we know this. DSM-5, there are 4 symptoms needed to make a gambling disorder diagnosis. And in the treatment and research community, 2 to 3 symptoms usually indicate problem gambling. So again, just to reiterate, because it's very important, treatment is available to anybody regardless of whether they're meeting DSM criteria. So part of that concern might be, oh my gosh, I don't know if I want to refer anybody in my agency right now because we don't have somebody that can do gambling assessments, or, we don't know what that could mean for anybody. And what we would say to that is, even if somebody is questioning if this is a problem, they can still be referred. And one of the things that I really would love everybody to keep in mind is how we're asking about gambling. And the first thing that I usually tell people when you go to ask about gambling is to very clearly define what you mean when you say gambling. So try to give a range of examples. Have you done any gambling, including video poker, scratch-offs, loot crate, and sports betting? That could include raffle, bingo, cards, dice, casino, online casinos, whatever that might be. We need to define what we mean when we say gambling. Because if the person that we're talking to only thinks of gambling as video poker, and we ask them if they've been gambling, they're going to say no, and that might not be true. And to answer an earlier question that somebody had in the chat box of if it can still be considered a gambling disorder if someone is, say, doing something like free poker, the answer to that is yes, it absolutely can be, because we're talking about putting anything at risk. That can be money, that can be time, that can be how we feel about our own, sense of self and self-respect. That can be, putting our lives at stake if we are drinking at the same time while we're gambling and we decide to drive home. Again, it could be anything that we're putting at risk. So when we're asking about gambling, we want to be very clear about what we mean when we say gambling and how we're having these conversations about risk. That way we're not giving anybody the false understanding that we're only referring to a narrow subset of things. Okay, next slide, please. So again, you might be very familiar looking at substance use disorder and being able to see this right column over here. Yes, these are the things that we're looking for. These are the things we may have experienced personally. And on the left column here, this is what we're looking for with gambling. So when your antenna is being developed, we're talking about, are people still talking about tolerance? Is somebody having withdrawal symptoms and they're way past their withdrawal point for the substance that they were using, but they're still reporting these same things? What might be going on there? We're talking about preoccupation. Is somebody talking about how am I spending my money? Where am I spending it? When am I spending it? If someone is telling you my entire paycheck is gone, if they're telling you I have no idea how I'm going to pay my bills, and you know that they had just gotten paid and they can't really describe where that money is going to. Any of these things that you're looking for. If somebody is escaping or talking a lot about how, oh, I just can't go home. I know that I can't go home. I can't go back to my group home. I can't go back and be around this friend. I can't deal with work anymore. I find myself on my phone so much. If you are in a session or a meeting with somebody and their phone is going off every 15 minutes and they just have to check, are they getting score results? Are they getting race reports? Again, any of these things that are just going to cause us to ask more questions. None of these things in and of themselves are going to be indicators that somebody has a problem with gambling. We won't know that until we see it and then we ask about it. Again, if someone is telling you about losing jobs, relationships, if somebody in their family keeps lending them money, if they're going to get payday loans, see a lender for some reason, we want to ask about gambling. And then this bit here about lying. And this is a little bit of a controversial one because lying is not called out directly in many different aspects of the DSM, but it is for gambling, because gambling and lying go hand in hand because it is so hidden. That we're talking about finances because, you know, we're trying to keep this something that's just in the dark. And when we're asking about lying, you never want to ask somebody, so, have you been lying the past couple of months about this? It's really not going to go over well. Please don't try it. But what we can ask is, do you feel like you need to hide the extent of what you're doing from other people? Do you feel like you need to hide things in your life about money? Is there anybody that you can talk to? Do you feel safe talking to anybody? Any of these questions can really get down to, what is your relationship with talking to other people about what is going on? And if that answer isn't very truthful or isn't really having the ability to disclose very much to other people, again, that's another signal to us that, hey, there might be something here that we need to address more. And, you know, one of the last things I just want to be able to say is, we're trying to have a collaborative right now to really be able to get more peers involved in treatment, because in the gambling community, we do not have a lot of peers right now. And it really does a disservice to the treatment we're able to do. You know, for myself, I have about 60 clients right now, and 60 clients that I cannot always see weekly, 60 clients that don't always get involved in other aspects of treatment because they might not qualify for it, but they're in the gambling program, and nobody to refer to. So what Oregon Health Authority is doing is developing very specific trainings geared towards peers to help allow peers in substance use treatment to be able to work with gambling disorder. And I love this because, again, we just need peers. We need help. We need that, you know, extra understanding that as a treatment provider, I'm not able to give. So right now, the training that exists, and this is something that is available on our resources on the app, as well as something that can be emailed with CEUs. Anybody working in an agency right now already offering gambling treatment is going to have the ability to do a training, again, completely free, that would then give you the certification needed to be able to provide services in the gambling program already existing in your agency. If you are not at an agency where services are already available, there's another training that's being developed, but it is not out yet, that is going to be geared towards, hey, how can we get you involved knowing that your agency isn't involved? So I apologize that right now that is specifically geared towards gambling programs that already exist, but it will be coming in the next few months that it will be everybody. I have a link to that, as well as a couple of email addresses for one of our peer mentors, Kitty Martz, as well as our OHA contact, David Corse. So anybody who has questions about those trainings would go to those two specifically. But again, you're more than welcome to email both me or Andy as well if you have any further questions about anything. You know, we're both kind of long-winded. We could talk about this for hours. But again, if you guys were able to get anything out of today, I really hope that it is just developing that gambling antenna to know where gambling comes from in our society and history, as well as then what we can do to really get people access to treatment, because it does fall on us. And I'm really happy that you all were here today.
Thank you.
Perfect. Thank you so much, Jessica and Andy. We do have a hard stop at 10:30, so there's just a couple minutes to ask questions. I do also want to say, like Jessica said, in the app, there are those resources, and we can also send those out in CEUs. Also in the app, you'll be prompted to fill out the workshop evaluation. So I'll pass it over.
Okay, awesome. And then again, for anybody who is in Oregon right now, the 1-877 My Limit helpline is one of the best resources that we have, as well as that number for clients that are Spanish speakers is 1-844-2-VALIS. And if you know somebody who would benefit from treatment, they can call that helpline number at any time and get connected to the treatment location that's closest to them, or get connected to our telehealth version, which is the GEAR program, which has some just kind of workbook trainings, as well as if you know someone who is already in a treatment program and doesn't feel like they're benefiting from that treatment program, have them call the helpline again and ask for other agencies that are doing treatment. We're going to be continuing telehealth moving forward. So you could access treatment in another part of the state right now when you might not have had that opportunity before, or to let your clients know that, or if they might be moving somewhere, whatever that might look like. That helpline number is a great resource because they will get you connected to anywhere you need to go, even if that is just connecting you with a clinician that you can call to ask them about what some of those options might be. So we never want anyone to feel like they're stuck somewhere that isn't working for them, because we're all trying to work together to really make this the best as possible. So that number is a great resource. And again, for Spanish speakers as well, we do have specific bilingual services across the state.
Thank you, everybody. Thank you, Katie. Thank you, MHAAO, for letting this, making this possible. And thank you all for showing up. Truly a pleasure to be able to speak to you guys. And also thank you all for what you do.
Yeah, absolutely.
Yeah, thank you both.
Jessica, real quick, I have a question for you. Oh, my microphone's not up here. So I am a certified recovery mentor and a PSS in both addictions and mental health. I'm really, really interested in getting training so that I can provide maybe some peer support, because the location I'm at does have some gambling treatment. Do I just shoot you and Andy an email about that, or?
Yes, so if you wanted to shoot me an email about that, I could give you any of the different links for what those trainings would be. I can also do some of those trainings because at LifeWorks, I'd be the person facilitating most of them. But then I can also give you David Corse's contact because he's going to be the best person for any future trainings.
Which is up on the screen right now.
Okay. Yeah, I tried to cut and paste it out and start my email immediately, but I can't seem to pick it up. So I just wanted to think maybe, Jessica, if I could connect with you really quickly, that how that would work.
And the slides will be available also, as will this recording, on the Peerpocalypse website.
And how do we get our CEUs after this?
We'll be emailing them to you.
Okay, thank you.
Yep, absolutely. All right, we're at time now. So, yep, Martha? Okay, cool. Yeah, applause. Thank you so much.
Okay, thank you guys.
Thank you, Katie. Thanks,
Awesome.
Jessica.
Of course, thank you.